Thank you, Dr. Inka. Hello, everyone, distinguished guests, colleagues, fellow researchers, attendees. I would like to present my talk today. I'm going to share my screen. And is it visible yet? Yeah, okay. So,
Yes.
yes, okay. So, good morning. My name is Ajib again, and I am honored to represent the WHO Indonesia Country Office to discuss about the global impact of mosquito-borne diseases at this joint webinar. So before we begin, please note that this event adheres to the principles of zero tolerance to sexual misconduct by the WHO, as represented by the QR code. And the presentation outlined of today's talk will be the global burden and trends of mosquito-borne diseases, and then continued with socioeconomic and health system consequences, which will lead us to the environmental and human drivers of the spread of mosquito-borne diseases globally, which will threaten the global health security, and also wrapped up with challenges and call to actions. And when we talk about infectious disease transmission, mosquitoes are considered the most dangerous animals on Earth, as quoted by the CDC, and they're the primary vectors of a wide range of pathogens, as we all know, including Plasmodium that cause malaria, and also many arboviruses like dengue, chikungunya, and Zika. And that vector-borne diseases account for more than 17% of all infectious diseases and causing more than 700,000 deaths annually. And malaria alone causes around 249 million cases globally, and with over 600,000 deaths that are mostly occur in children under the age of 5 years. And dengue has been recognized as the most prevalent viral infection transmitted by mosquitoes, with asymptomatic cases and estimated of 40,000 deaths every year. So the burden of these mosquito-borne diseases are heaviest in tropical and subtropical regions and disproportionately affecting the poorest populations mostly. And since 2014, major outbreaks of dengue, malaria, chikungunya, and Zika has been repeatedly reported in around the world. And if we're talking about the global malaria burden, so malaria continues to place a huge burden on global health. And in 2023, there were estimated of 263 million new cases of malaria worldwide, which was a slight increase from the year before. And as I mentioned before, that the deaths are mostly coming from young children population. And the African region still carries the heaviest share with approximately 95% of cases and deaths. And within just 5 countries like Nigeria, Democratic Republic of Congo, and then Mozambique, Uganda, and Ethiopia. And these 5 countries account for almost half of the global burden of malaria. But to note that Southeast Asia region still counts as a significant pocket for malaria transmission, and Indonesia is currently ranked the 32nd highest in terms of estimated malaria cases globally. And what we would like to note is that there has been resurgences in the Eastern Mediterranean region of in terms of malaria incidence. And as some of you might have been aware that Indonesia has just been moved from WHO Southeast Asia region to Western Pacific region. In the former, the graph on the left side showed you the position of Indonesia in terms of malaria burden and of malaria cases in Southeast Asia region, which we rank the second after India. And when we move to the Western Pacific region, to the figure on the right side, we're still on the running to become the first place. Indonesia is still ranked the second after PNG. So regardless of WHO regional grouping, Indonesia remains among the highest burden countries regionally. And as you can see on the right figure, that Malaysia has had no cases of human malaria for 7 consecutive years. But for the past 8 years, there has been an increase in the number of indigenous zoonotic Plasmodium knowlesi malaria cases, which may somehow hinder them from getting the malaria elimination certification by the WHO. And talking about the global dengue burden, so the incidence of dengue has increased significantly over the past 2 decades, and from around only 500,000 cases in the year 2000 to over than 14 million cases in 2024. So it was the highest ever recorded in a single year of dengue cases, and the true burden it should be even higher because the asymptomatic uh, cases and also the cases that are unreported. And the Americas accounted for over 13 million cases, and Asia and Latin America remain hyper-endemic regions. But the thing is, dengue is now reaching new regions, including Europe and the Eastern Mediterranean, where local transmission has recently been reported as well. So this shows how dengue is no longer confined to only tropical or subtropical areas, but also becoming a global health threat. These is mostly caused by the expanding Aedes vectors, climate change, and so on, which we will discuss later on. So mosquito-borne diseases beyond malaria and dengue, mosquito-borne viruses like chikungunya and Zika continue to cause major outbreaks. And it's not only arboviruses, other mosquito-borne diseases like lymphatic filariasis continues to also affect the world's poorest populations with social stigma and lifelong disfigurement. But the map shows you the countries and territories with transmission of chikungunya, dengue, and Zika viruses, in which the countries with a blue color show transmission of all three viruses. So they're co-circulating in these countries. And these diseases, of course, have overlapping transmission dynamics, and co-infections may occur. And the thing is, climate change, rapid urbanization, and human mobility also uh, play a major role in expanding the range of Aedes mosquitoes, and that health workers and public health professionals should be more aware of possible co-infections and uh, the co-circulating of these viruses, including in countries co-circulating with malaria. Talking about co-infections, this slide highlights the challenge of malaria and dengue co-infections. As you can see on the table, there are certain characteristics of concurrent malaria and dengue infection symptoms because they might have overlapping symptoms such as acute fever, rashes, headache, and flu-like symptoms that making it difficult to distinguish them clinically. So, yeah, co-infections may occur, but it is quite rare. But the thing is, if you're working in endemic area of malaria and dengue, then you should be aware of these co-infections. So high suspicion is essential. And that the WHO has recently published a guideline on clinical management of arboviral diseases and updated the guideline for malaria case management to guide health professionals in managing these cases. We're now talking about the impact of malaria and dengue and other mosquito-borne diseases that goes far beyond health impact. So, malaria alone drains Africa's economy by approximately 12 billion US dollars each year. In years lost of productivity, and additionally, dengue outbreaks will overwhelm hospitals during peak transmission seasons because of the hospitals that are full, and health workers that are overwhelmed with the surge of patients and so on. And as we live in Asian countries, so Asia faces a double burden with malaria and dengue co-circulating in the same areas, driving high daily adjusted life years with more than $80 million annually, so making them some of the leading causes of lost healthy life. And as you can see on the figure, on the blue one, the dengue Delhi, the children under 5 years, similarly to that of malaria, children under 5 years are the most vulnerable groups, aside with pregnant women group. So at the same time, school absenteeism and lost productivity undermine the education and economic growth, showing how these diseases not only affect individuals but also the entire society. And this shows you the sample of schemes how the mosquito-borne diseases can impact economic situation and productivity of individuals. So let's look at the first figure on the left. It shows how mosquito-borne diseases translate into productivity losses. So these cases can occur among working age population, children, as well as elderly population. And for adults, illness will directly reduce time at work. For children, they will uh, somehow lost cause the loss of caregiver productivity. So because of loss of time, so adding another layer of productivity loss. And both ambulatory and hospitalized case will also cause work days lost per case. So that's how this impact the productivity of people contracted with mosquito-borne diseases. And the figure on the right showed you the impact of mosquito-borne diseases, particularly in search of cases or outbreak on tourism and demand. So outbreaks will reduce the international tourist arrivals and means less spending by visitors. And this decline will affect multiple sectors like hotels and then restaurants and retail, transport, as well as food industries. And rippling effects will occur. So suppliers will lose income and households will spend less and creating induced economy losses. Uh, so the direct, indirect, and as well as induced effects ripple through the entire economies from this mosquito-borne diseases. If we're talking about the health system impacts, so dengue and malaria will quickly overwhelm health facilities in terms of outbreaks or surge of incidences. And these will somehow strain the capacity of healthcare facilities like primary care centers and hospitals. And that because the healthcare workers are so busy treating these patients of malaria and dengue outbreaks, though they will be somehow diverted into the other essential services like maternal health, child health, as well as immunization services. And of course, with the increased demand of diagnostic tests, hospital admissions, and other logistics, this will somehow drive up the health costs, especially during outbreaks or peak seasons. And if this happens in rural or low-income communities, then it will cause more complications because they have limited access to healthcare services. So this will somehow hinder the progress towards achieving the universal health coverage as we targeted. And now I previously mentioned about the expansion of mosquito vectors uh, due to climate change. So basically, there are three uh, impacts from these climate change itself. So the changes in the temperature, rainfall, and humidity will alter mosquito habitats and seasonal patterns of malaria and dengue transmission. And also, in terms of climate change, like rising temperatures will speed up parasite development and also virus development inside the mosquitoes. So it will make them infectious sooner, which also increase their feeding frequency. And in terms of extreme weather like floods, droughts, and storms, they will trigger surges in mosquito populations and will eventually cause outbreaks. And during these times, interventions such as insecticide spraying, like a space spraying for dengue or IRS or the distribution of bed nets will also be quite difficult during extreme weather. And as these happen in a very long time or happen chronically, changes in mosquito behavior will cause shifts in biting times and then resting places, even feeding preferences that will somehow increase the human mosquito interactions and make interventions previously implemented to according to the previous behavior of mosquito will be less effective. So these three things are considered the major drivers of expansion of mosquito-borne diseases globally. Additionally, we have to note the urbanization and change in landscape use in terms of expansion of mosquito-borne diseases. So basically, urbanization and changes in land use will, especially the unplanned urbanization and temporary settlements will expand Aedes mosquitoes through water storage, construction sites, and discarded containers. And it is even worse if these transformation of landscape happen in a long time. So long-term land transformation that will create even more stable and high density Aedes population that will somehow make the risk of epidemic greater. In terms of Anopheles density, so deforestations and changes of land use in terms of agricultural use and even land conversion will also alter mosquito ecosystems. So for individuals developing settlements in the forest and they cut down the trees and so on. So they will have more potential or risk in transmitting in contracting malaria because of the exposure to Anopheles mosquitoes. These are even worsened by the high population density and mobility, and also trade and travel, as you can see on the figure on the right side, the number of zoonotic Plasmodium knowlesi cases has been increasing. That may be due to deforestations and changes in land use. So these mosquito-borne diseases are not only national health challenges, but also global security threats. And we've seen how dengue and malaria outbreaks can overwhelm health systems, similar to the overlaps of the outbreaks of Ebola. If we take a look a few years back in West Africa, so they have outbreak of Ebola as well as the ongoing transmission of malaria, so they're overwhelmed. And in terms of international travel and trade impact, during the Zika outbreak in 2016, there were like travel ban and trade restriction in terms of reducing the risk of Aedes importation or Zika importation during that time. And what we need to note here is that when outbreaks of dengue, yellow fever, chikungunya, Zika, or unexpected malaria resurgences spread across the borders of country, then they can be declared as public health emergency of international concern. And under the international health regulations. So that's why strengthening vector surveillance and then response capacities at airports and then seaports and border crossings is essential to prevent the international spread of mosquito-borne diseases. And not only about the traveling human, mosquitoes can travel too. So the global threat of invasive mosquito species such as Aedes albopictus and Anopheles stephensi, they are two of the most invasive mosquito species that can adapt easily to human environments. So in terms of Aedes albopictus, they can survive in more temperate climate and cause the outbreaks of chikungunya and dengue in many European and Eastern Mediterranean countries, while Anopheles stephensi is even more adapted to urban environment. So they can even breed on water containers, construction sites, and so on. So they have a similar behavioral pattern as in Aedes mosquitoes. And to respond, of course, we need stronger surveillance, regional cooperation, and integrated vector management. So, despite the ongoing global burden of malaria and dengue, many countries have achieved major progress in malaria control and elimination. So you can see the map on the left showed countries certified malaria-free by the WHO up um, as of 2023, if I'm not mistaken. So basically, these countries have been certified malaria-free by the WHO, and the figure on the right show you the progress of some countries achieving elimination, including Timor-Leste, Malaysia, Saudi Arabia, Suriname, and Bhutan. Suriname has just recently certified malaria-free by the WHO a couple of months ago, and Timor-Leste, I think, is going to publish the certification soon. And what we need to emphasize here is that uh, setbacks in some countries should remind us that sustained investment and vigilance are important to maintain these malaria elimination efforts. So if you can see on the right side in Iran, the malaria cases has been re-emerging after 2021 because of the weakness of public health system. And in terms of global progress in achieving zero dengue death as the new target for dengue control by the WHO, so we can see on the left that reported dengue deaths from 2010 to 2024. So the mortality has been fluctuating with peaks during major outbreaks like in 2023 and 2019. And while the long-term goal is zero dengue death, achieving this will majorly depend on strengthening early detection, case management, and also hospital readiness, especially in terms of outbreaks. And the figure on the right, the number of reported dengue cases has been rising significantly, particularly in 2023 and 2024. And the challenge for public health professionals and also healthcare workers is that while the cases are increasing because of the improvement of case detection, deaths must continue to decline through strengthened health system, and that is the one of the major challenges in achieving zero dengue death. So to ensure that most infections remain non-fatal. So, talking about challenges in mosquito-borne disease control, basically, seasonal surge of incidences will overwhelm the hospitals, diverting staff and disrupting essential services like maternal, child health, immunization services, and so on. And the second one is that treatment, hospitalization, and loss of productivity place a huge financial burden on the economic condition of both households and also at the national level. And rural and poor communities are hit hardest because of the limited care to healthcare access. And we should also take note of the overlapping symptoms that may delay diagnosis and care. And then the climate change that expands mosquito habitats, including the emergence of or the spread of invasive mosquito species. And then weak surveillance, limited preparedness will reduce outbreak response capacity. And finally, chronic underfunding and fluctuating donor support continue to hinder sustainable long-term program achievements or implementations. So, to address the growing threat of mosquito-borne diseases, we need to strengthen vector control as core public health service. So integrating with water, sanitation, housing, and urban planning to reduce mosquito breeding sites. And then at the same time, we must build resilient health systems that can rapidly detect and respond, even during climate shocks or humanitarian crisis. And third is that investment in innovation and research is essential to adapt intervention to local context because of the changing demography of the disease as well as the changing behavioral pattern of the mosquitoes. And that we have to involve communities and local authorities as active partners in the prevention, surveillance, and outbreak response. And securing long-term financing and political commitment to sustain progress is also essential. And again, multi-sectoral collaboration across health, environment, education, urban development, and other relevant sectors are vital to address the root of social and ecological drivers of the spread of mosquito-borne diseases. So these are some of the take-home messages from our discussion today. So the first one is mosquito-borne diseases such as malaria and dengue remain a major global health threat, causing millions of cases and hundreds of thousands of deaths each year. And climate change, rapid urbanization, and human mobility are accelerating the spread of Aedes and Anopheles mosquitoes, driving new epidemics in previously unaffected regions. Outbreaks place a heavy burden on health systems and economies, overwhelming hospitals, disrupting essential services, and costing billions in lost productivity. So we need stronger surveillance, resilient health systems, and sustained investment to control transmission, protect vulnerable populations, and meet global targets such as SDG 3.3. These are the main references I use for the presentation. And thank you very much. Please, Dr. Inka, time is yours.
Thank you so much. Thank you so much, Dr. Ajib, for the very interesting first plenary this morning. I would like to invite our audience to ask any questions. Please write down the questions in the Q&A column, and we will give the questions to Dr. Ajib. So I don't see any questions at the moment, but I can start with the first questions. I know, as you mentioned, that many areas in Indonesia, in particular, have the co-circulation of malaria and dengue. And we also know that land use change and urbanization play a big role in making the areas more prone for the dengue transmission. And how would you suggest, like for those areas who are not endemic for dengue, to integrate the vector control that are already established for malaria to also cover the protection for dengue transmission?
Yes, Dr. Inka. So if you're talking about areas or regions that are endemic to both malaria and dengue, then we need to have these certain approach called the integrated vector management or the IVM. So basically we can do certain vector control interventions that target different mosquito species at once. So for example, if we want to do the biological control of the larvae eating predatory fish that eats the larvae, the mosquito larvae, that we can do that as well um, to both control mosquitoes causing transmitting a dengue virus and also Plasmodium. And in terms of IVM, it is much more how do you say that much more encouraged for multi-sectoral collaboration or the cross-sectoral collaborations to control these mosquitoes. So not only the health sector responding to the vector control program, but also different sectors such as the Office of Environmental Health or the forestry or the urban planning to have the renewed or improved infrastructure in terms of irrigations or any other sort of landscape change that is can be considered healthy in terms of not creating new breeding sites for mosquitoes. So basically, it will require much more effort to do this integrated vector management, but the impact is much greater as well. So I would say that cross-sectoral collaborations in terms of infrastructure improvement, like irrigations and reducing mosquito breeding habitats in the both urban and suburban areas are the most important.
Thanks, Dr. Ajib. We have two questions in the Q&A columns and also like to raise hands. I will start with the question from the Q&A first. There is an expansion of dengue in Europe. What do you think? Is it due to the climate change or the adaptation of the factors?
Yes, so if you're talking about the which come first, it will be quite difficult to answer, but I would say that the climate change will cause um the adaptation of vectors because of the ongoing change in climatic factors and also conditions. I mean, mosquito behaviors does not change overnight, so it has to undergo some sort of period of time before it can change its behavior to adapt with the new environment. And the first outbreak of chikungunya in Italy, if I'm not mistaken, was somehow brought through the if you have have you ever heard about luggage dengue or Aedes transported through the plane or carried along with the suitcases of travelers? That's actually an interesting thing as well. So that may also cause the spread of these arboviruses in the Europe. So if when the climate pattern changes and the mosquitoes are adapted to these changes, then of course they will still need to feed, right? They need to suck blood. So they have to somehow survive these more temperate regions such as European region. So yeah, climate change will cause the changes in mosquito behaviors, but also worsens by the international travel and trade. Because the presence of mosquitoes, only the presence of mosquitoes may not bring the disease, right? Unless the viremic individuals traveled or present in the area as well, so local transmission can occur. So that's the case in that happened during dengue and chikungunya outbreak in the European countries. Yep.
Okay. Thanks for a very clear explanation. I would like to invite Pak Asik to raise your question, to address your questions to Dr. Ajib.
Yeah, sorry. Can you hear me? Hello.
Yes, Bapak.
Yes, we can hear you.
Thank you. So I just trying to open my pictures. Okay. Um, uh, thank you so much, Pak Haji. This is really, I mean, enlightenment for us, especially, and enrichment for the global perspective, actually. I know that the malaria, especially in the global, when we say the global report is increased, right? Especially like in Africa, and also at the point of the in Indonesia is also the increasing for the cases. I think this is we have to one on this on this issue. Um, I know just only the vaccine that we have currently developed, even for the efficacy is still lower. But another strategy, another tools, we just only you see that only just rely on the conventional, yeah, conventional strategy that we have it. But we see that the challenging uh, for the futures is really huge, especially like the climate change, global warming, mobilization, and so on and so forth. I know that borderline, something like that, is really changing a lot for us. And I see also the commitment, especially for the leadership. It's really important for us. I think it's not really changing for this kind of the issue. This is the one. And the second, I think we see for the dengue. Yeah, the dengue. I think the global is not put it in the high commitment, especially like the dengue, especially previously they have like their um, a strategic plan itself thoroughly, yeah. But now they are put it at the integrated one as entities, and the dengue is one of 20 yeah 20 diseases, something like that. But it's not really emerged uh, when we bring it into the advocacy, especially to the parliament, to the others, and then they say that the global is not really put really commitment like the AIDS, TB, and malaria, something like that one. But this is the issue, especially when we put also in the neglected tropical diseases, put it in together in the strategic plan in one, and then we see that we have to compete, yeah, to compete the political awareness, political commitment, budget, the policy, and something like that one with the others like the HTB and malaria, and also immunization, something like that one. This is really the disadvantage, especially for the country such as Indonesia, like Indonesia or Brazil, for example, that's really huge for the dengue. When we see also this is really huge because the DALIS disability after last years for the dengue itself is greater than HIV plus sexual infection, and also even with the malaria also. So this is huge for the DALIS, but meanwhile they put also as the neglected, and commitment is neglected, and also for uh, the budget is also neglected. But this is I think is we really need that the global, especially like the WHO, or also put really strong push, especially for the country. I think I yesterday meeting with some of the members of parliament. They're also asking about like the how the global also, because some of course like I mean the parliament advocator sometimes is also referred to the global the global commitment. But it is I think it's really important just for not for especially for the neglected tropical diseases, including dengue and also the malaria. Thank you, Pak Ajib. This nice presentation so far.
Thank you, Pasik. Is there any comment from Dr. Ajib to respond to Pasik?
Yeah, I would like to also highlight the importance of strong financial commitment, also political commitment from the government, and also relevant partners, and also the other counterparts to sustain the progress of the elimination or the control of these mosquito-borne diseases. And in light of international document by the WHO, the WHO has not that recently published the Global Arbovirus Initiative. So while dengue is still under the neglected tropical disease group, but the document has started to be distinguished from the NTD roadmap. It is still in the NTD roadmap, but they have the other document called the Global Arbovirus Initiative published in 2024. So it also addresses other arboviruses like chikungunya, Zika, and so on. So in light of that, more concern has been growing towards Aedes-borne diseases in terms of international commitment. That's it, Dr. Inke. Over to you.
Thank you, Dr. Ajib. We have two more questions in the Q&A columns. If I can ask for the operator to share the questions. The first one is, how is the newest area in Indonesia that has eliminated malaria? Can we claim that Indonesia has eliminated malaria? If I understand that right. And the second question, during some rainy seasons in Indonesia, usually is followed by an increase of dengue cases. Is there any example from other regions or countries that has successful story in preventing or controlling dengue following rainy seasons?
Okay, I will try to answer the first question about the elimination of malaria. So, no, not yet. The certification of malaria elimination by the WHO will be given at the national level, at the country level. So, as Indonesia, as of today, has not yet certified malaria-free in all of the districts and cities. So the certification of malaria-free status from the WHO may not be given today. And then, but we are trying to do a regional elimination assessment, validation by the WHO, and yeah, I think if the assessment, the results of the recent assessment in Jogja has been going well, then they can propose for the regional assessment validation of malaria elimination of Java Bali in the near future. And then the second question was how to deal with increasing dengue incidence in the period of rainy season. Is that correct? Yep. So
Yes.
yes. So changing pattern of rainy season has been the one of the most major challenge in controlling incidences of dengue. But if you want to look back for the past 5 to 10 years, you can see the this is what most countries have been using with the adequate data, such as Singapore and also Thailand. They have been using the pattern of rainy seasons, and 1 to 2 months before the rainy season starts up until the 1 month after the rainy season stop. So they will expect a surge of dengue incidents during those periods. So it doesn't matter whether the rainy season started early or later during this period. This will be the exact period of these dengue incidents to increase, and that is when the health system should prepare for the upcoming outbreak of dengue if it's happening, and the increase of dengue incidents during those periods. So and during this period, they will also somehow encourage people to do mosquito source reduction practices and be more aware of dengue transmission during these seasons. Yeah, if you're asking for best practices, yeah, that is one of the best practices.
Thank you, Dr. Ajib. We still have more time, maybe just for one last questions. Can the committee share the slide deck for the question so we can choose which one to answer? There are more questions in the chat column, so.
I think one participant is raising her hand from
Yes,
Sudinkas.
okay. Let's wait. I'm not sure if we would have time like to have a live questions. So let's just go for the question in the column, the chat column. Okay. Yes. So how is malaria control action research using innovations in larva-eating fish, biological predators, and what is its scientific impact?
Okay. So honestly, I'm not sure if I'm if I'm if this was covered during my talk, but I will try to answer anyway. But if the later speakers in the later sessions can have answers to that to complement that, it will be very good. So basically, in terms of Anopheles larvae control through predatory fish, it has been proven quite challenging because of the types of mosquito breeding places or larvae habitat that is mostly different from Aedes larvae. Excuse me. So in for Aedes larvae, we can easily identify the normal or usual breeding places, which are the water containers or man-made or natural containers. So we can just release fish in those containers, such as ponds and so on. But for Anopheles larvae, it is quite difficult because different Anopheles species might have different breeding habitats. So some might lay eggs on the like slow running streams. Some may lay eggs in a swamp with stagnant water and so on. So if you just want to throw predatory fish everywhere that has in every water container or water filled body or water bodies, then yeah, you can do that, but I don't think that it will be, I mean, like scientifically speaking, evidence-based speaking, it will not be effective in any way. And yes, I would say that it has been challenging and that the some of the I've read some of the articles that showed promises on the use of predatory fish to as a biological control for malaria, but uh, at the moment, I don't think the evidence itself is sufficient to support the use of predatory fish for uh, larvae control for malaria.
Thank you so much, Dr. Ajib. I think because of time restriction, we have to end this session. So thank you for your fantastic presentation and also discussion. We have so many questions still not answered, but I hope like when they meet you in person, they can ask the questions directly. So thank you so much again.
Thank you, thank you.
Okay, so now I will return this to the MCs, and that's it for the first plenary session of this morning World Mosquito Day webinar. Thank you.